everybody. Please excuse my voice. I'm recovering from a bit of a cold, so I hope I'm clear. I'm very excited to speak to everybody today with regards to our experience with local manufacture of a Unimap MMS specified product and what we have to share in this regard. And it ties very much into what Clayton has said, what Alison will say next as well. So I'm sure we'll have a lot of questions afterwards, so we'll get straight into it. There we go. Great. So when we speak about local production and the importance thereof, what we're really referring to is the vital role that of local production in maintaining the resilience of a national healthcare system. So especially when it comes to facilitating access to required medicines and decreasing exposure to imports and international supply chains. Now, on-continent manufacture could help to mitigate future supply chain disruptions and build more sustainable systems with improved and sustained access to health products. Now, of course, there is a decision that needs to take place with regards to where a local production hub should be set up. And what comes into consideration here are topics like trade routes, regulation harmonization, etc. And there are also some risks to local manufacture, when it comes to availability of raw materials, packaging components, taxes, etc. But I know Alison will be diving into that in a little bit more detail, so I'll leave that to her to cover. So why can we stand here today and speak to you about this topic? So really, in the last 4 or 5 years, we have dedicated a large amount of time to understanding what it takes to locally manufacture a Unimap MMS specification prenatal. And specifically speaking to our exposure and our development in South Africa, we are now at the point where we have a successful 36 months stability data in place. We're also developing a hub in other regions globally, one in Brazil and one in Indonesia as well. And at the moment, both have about 12 months stability data in terms of time points. So we really have invested a lot of time, and we believe that we have now really captured the technical expertise and the specificities that are required to manufacture a Unimap MMS product. And the idea is that we have an immense amount of knowledge to be able to share with other potential manufacturers in countries where potential local manufacture is being considered, as well as looking into how we can enhance and potentially speed up the process in Nigeria as well. So our team really has a deep sense of know-how, and the idea is that we have now captured this, and technical transfers can take place quite effectively from this point. So basically, the major factors that are identified for consideration when developing national supply strategy. And the focus of those really do affect the creation and the maintenance of regional manufacturing hubs and the localization of production. So 4 topics are policy, regulation, manufacturing and quality control, and finally procurement, financing and distribution. But I believe that policy as well as the procurement topic will be covered in other sessions. So I'll focus specifically on regulation and the actual manufacturing and quality control components. So I just want to give you an example of some questions that we do consider. So first of all, what are the regulatory requirements of the country of manufacture? And I know later on we have a session by the Ethiopian FDA, so I thought to use Ethiopia as an example, and South Africa as well. So in both Ethiopia and South Africa, this product is considered a pharmaceutical product, and registration, etc., takes place as such. When you, for example, looking at, okay, we have a product in South Africa, how do we get this then exported into additional countries. Using Ethiopia again as an example, there are various categories of information that are required, from authenticated manufacturing licenses and GMP certification to a free sale certificate, certificate of analyses, batch manufacturing records, as well as artwork and leaflet detail, both in the language of the country of manufacture and the receiving country. One also needs to consider other questions, such as, are there import restrictions, tariffs and taxes on raw materials that are going to be needed for the local production of a product? What are risks associated around availability of manufacturing equipment, and could this put Africa-based manufacturers at a disadvantage? So really just posing a few questions here. I wanted to show an explicit example of the South African landscape. So on the left-hand side of the slide, you see the UNIMAP formulation, 15 micronutrients. Now, in South Africa, we obviously have a legislation which informs whether a product falls into a dietary supplement or pharmaceutical category. There's one micronutrient on this list, is iron, which pushes this product, this alone, into the pharmaceutical category because it contains 30 milligrams of iron, and in South Africa, SAHPRA allows for a limit of 24, an upper limit of 24 milligrams of iron. So the context of our South African manufactured product at the moment is that this needs to be registered as a pharmaceutical product and then exported as such. And this all implicates your free sale certificate and then the requirements in the country of receipt. So this is a similar exercise that can also be taken up in your countries to understand how this product is ultimately going to be classified, either for production or import. And now if we looked at the technical approach to manufacturing a product, as well as the quality control mechanisms, here just really showing the adherence of the manufacturer specifications, not going into this detail, but Clayton did mention the UNIMAP consensus document that is now being reviewed, I think, for the third time, and this ultimately details the considerations when a product is manufactured based on the quality that is required. We need to look at the inherent technical approach when developing a product. So this comes from formulation right through to packaging. So when formulating a product, you need to design and source high-quality active ingredients. So receiving a premix of active ingredients ultimately allows for reduced handling and QA and QC complications as such. One needs to consider which excipients need to be included in the final product. And then finally, really to ensure the stability of this product over the really robust stability conditions, we need to ensure that you have a really robust moisture barrier coating, which ultimately surrounds and protects the micronutrients in the product. And then one also needs to consider packaging components. So packaging counts. Is it a bottle of 180s, a bottle of 100s, or a bottle of 30s, or blister of 30s that is required? And evidence might still come as with regards to the distribution of these products, the uptake, the adherence rates, clinic attendance, visits, etc. And I'm sure all of the countries have different considerations that are in place currently with regards to which packaging format they would prefer. Then it obviously comes to identifying a manufacturer of this product. So this is quite a tedious process because you would need to do a landscape analysis to identify accredited and quality manufacturers. Generally, there's an internal as well as external audit process that takes place here. One would need to look at a gap analysis, so what CapEx or capital investment is ultimately required to bring this local manufacturer up to the scale, the quality scale that is required. And then one would initiate pilot trials to understand that a local manufacturer can produce this product, but also at a cost-effective price, because this is critical. And finally, when we're speaking manufacturing and quality control, there's the analytical component. So one would need to understand the local manufacturer's capability for final product analyses, or then understand nationally or regionally whether there is local lab capacity and capabilities for including method validation and verification. And there's a whole lot of components included in here in terms of assaying of active ingredients, heavy metal analysis, microbiological purity, etc. So this really was just a high-over introduction as to really what it takes to manufacture a final product. As we said, whether locally or regionally, I think it is important to really bear all of these aspects in mind. Here, I'm just showing you what, the intricateness ultimately of what a stability study looks like. So as I mentioned, what is required is 36 months long-term or shelf stability on all 15 vitamins and minerals at various conditions. So you get, generally in Africa, zone 4B is applied. So yeah, a busy slide, but really just shows what a stability protocol, successful stability protocol should look like. And finally, I also saw this in Alison's slides coming up, so I won't spend too much time, but I really wanted to give you a bit of a timeline based on our experience with regards to the components that are required when setting up a local manufacturer. So we ultimately start, as I mentioned, with identifying and qualifying an MMS manufacturer. I mean, this could take 3 to 6 months on average. I don't know this slide off by heart, so there we go. Then one would go through the product development phase. So ultimately, as we said earlier, you'd need to identify your mix of premix, mix of micronutrients, your formulation, your overages, your packaging formats, and ultimately understand the regulatory assessment per country to understand how this product needs to be produced. One would then go into the product, initiating a product readiness. So you'd really, this really starts at time point 0 of your stability study, and this really informs the longest aspect of this product development process, because as I mentioned, we do require 36 months real-time stability studies. So 36 months being adding 3 years to your process. Of course, in the meantime, many other components can be completed, such as your in-house validation and verification processes, your registration process of the product that can be initiated, discussions with your local, say, health products association. And then, yeah, ultimately one would need to decide if this is going into social safety net channels, potentially market-based channels. I think here the stability timelines do differ slightly, as well as some of the approvals that are required. But this just gives you a general overview of what this timeline is. And yes, I think that's everything I had time for right now. I'm sure we've raised a lot of questions. I know Alison will hopefully cover a few of these, but I do welcome you to approach me and ask any other questions. Thank you.